Today we are going to discuss diclofenac. This diclofenac sodium is the most commonly used non-steroidal anti-inflammatory drug. So brand name of this diclofenac sodium like Voveron, Diclo and so many other brand names. So first of all we'll see what are the various actions of this diclofenac. It is used as an analgesic, antipyretic and anti-inflammatory drug. Now, analgesic, antipyretic, and anti-inflammatory action, it's because of its inhibition of cyclooxygenase enzyme or COX enzyme. It inhibits the COX enzyme, and because of that, it reduces intracellular concentration of arachidonic acid in leukocyte. It reduces intracellular concentration of arachidonic acid in leukocytes, and it also reduces the neutrophil chemotaxis. It is more effective and hence commonly used non-steroidal anti-inflammatory drug than other NSAIDs. It is more effective and hence commonly used. It has some selectivity for the COX-2 enzyme. It has some selectivity for the particular COX-2 enzyme, and there is no antiplatelet effect like low dose aspirin. Hence, there is no cardioprotective role. There is no antiplatelet effect like low dose aspirin, so there is no cardioprotection. Pharmacokinetic properties will see when it is given orally, it is rapidly absorbed and complete absorption is seen. Oral absorption is rapid and complete. Peak plasma concentration achieves in 2 hours. Oral bioavailability is 50% because it undergoes extensive first pass metabolism, and because of that oral bioavailability is just 50%. Plasma protein binding is about 99%, but half-life is just 1 to 2 hours. Duration of action significantly longer due to accumulation in the synovial fluid. It will get accumulated in the synovial fluid and it will get metabolized by the glucuronide and sulfate conjugation, and it will get excreted in the bile. So these are the pharmacokinetic properties of diclofenac. Clinical status, it is the most commonly NSAID because it is available via various routes, like orally it is given, parenterally it is given, and topically also it is preferred. So oral, parenteral and topical routes by which we can prefer this diclofenac. Now, therapeutic uses where we can use diclofenac in orthopedic conditions. In the dose of 100 to 200 milligram in the divided doses. We can use this diclofenac in rheumatoid arthritis, osteoarthritis, ankylosing spondylitis. So, in orthopedic conditions or musculoskeletal diseases like rheumatoid arthritis, osteoarthritis and ankylosing spondylitis, as we have just said, it will get accumulated in the synovial fluid. So it is beneficial in all these conditions. It is also used in short-term management of acute bursitis, tendinitis and musculoskeletal pain. It is used in the short-term management of acute bursitis, tendinitis and musculoskeletal pain. It is also useful in dysmenorrhea, toothache, renal colic and post-operative inflammatory pain. So it is also useful in the pain during menstruation or difficulty in menstruation, that is dysmenorrhea, toothache, renal colic and post-operative inflammatory pain. Now adverse effects, mostly it is a GI irritant. So GI side effect like nausea, vomiting, dyspepsia, abdominal discomfort. And when you are using this drug for long-term period, so it may lead to peptic ulceration, perforation and GI bleeding on long-term use. It is less common, but they may see on long-term use. So allergic reactions, skin rashes and edema is also there because of sodium and water retention. So allergic reactions, skin rashes and edema is because of sodium and water retention. So in that condition, we will prefer diclofenac potassium salt to avoid the volume overload. Instead of diclofenac sodium, we will prefer diclofenac potassium to avoid the volume overload. Cardiotoxicity in newer studies, it is not safe in patients with pre-existing heart disease. It is not safe with patients of pre-existing heart disease. So it better avoided in those patients. It is also avoided in children's, and it is contraindicated in pregnancy and lactation. It is contraindicated in pregnancy and lactation, and dose is 50 milligram BD orally, or it is also given parenterally 75 milligram deep intramuscular. So it is the most commonly used NSAID because it is more effective as a antipyretic, analgesic and anti-inflammatory drug.